Good day everybody. So today I was assigned to discuss my reading. So my article that I chose is about ectopic pregnancy with an article title of Ectopic Pregnancy, Early Diagnosis Can Be Life-Saving by Dr. Shanshikala Handy, and she published this on July 24, 2019. To start it off, ectopic pregnancy is a term used when the egg settles and develops in the endometrial cavity. So technically speaking, in the normal process of pregnancy, the fertilized ovum will travel from the fallopian tube towards the uterus. But in this case, for the ectopic pregnancy, the fertilized ovum has not traveled successfully to the uterus. That is why it has implanted and developed itself on the or in the fallopian tube or any place aside from the uterus. So, according to Dr. Shanshikala Handy, the possible causes of ectopic pregnancy are due to the increased rate of prevalence of inflammatory diseases, or specifically saying pelvic inflammatory diseases, contraception failure, use of intrauterine device, tubal reconstructive surgery, history of infertility, assisted reproductive therapy, endometriosis, and post-tuberclectomy and previous ectopic pregnancy. So technically, with those history, the fallopian tube or the linings in the fallopian tube has been altered. That is why it could either there's scarring, so it will technically prevent the fertilized ovum to travel, and on the other hand, the cilias in the fallopian tube might be also not functioning well, making it does not help with the propagation of the fertilized ovum towards the uterus. Now, early signs and symptoms of the ectopic pregnancy usually occur within the first week of pregnancy, where some of these are overlooked by mothers, and these are the following. First is amenorrhea, history of delayed period, history of vaginal spotting, pelvic pain, vaginal bleeding, vomiting, fainting attack, extreme abdominal cramps, pain on one side of the abdomen, dizziness, weakness, shoulder pain, neck pain, pain in the rectum. Technically, if we are going to say early diagnosing, this could be just like the painless vaginal bleeding, simple abdominal pain. But when we say it's already, let's say, the shoulder pain, that could already means that the ectopic pregnancy is ruptured. But why do we consider it then as an early diagnosis? Because some mother doesn't know that they're actually pregnant. Because this happens in the first week or the first trimester. So if you do not know that you're pregnant, you technically are not knowledgeable enough what's happening inside your abdomen. So in diagnosing the suspected ectopic pregnancy, they use one of the most effective tool or effective procedure, which is called the transvaginal ultrasound. So with this, it has an 87 to 99% of sensitivity in diagnosing the said condition. And aside with this, it is going with the help of the serum HCG test. It is also able to detect whether you are having an ectopic pregnancy or not. And lastly, one of the diagnostic tool is called the laparoscopy, and it is more actually used when the condition is much worse, and let's say it has already become, or the ectopic pregnancy has ruptured. Next is, what are the possible treatments of ectopic pregnancy? So according to Dr. Shanshikala Handy, there are three ways. First is the conservative method, second is the medical method, and lastly is the surgical method. So the conservative method is mainly, it's just actually not taking certain immediate action. Technically, it's not yet in the dangerous stage. So what you have to do is no immediate treatment, but rather a close monitoring of the patient. But this is only viable to those stable mother with an ultrasound diagnosing of unruptured ectopic pregnancy, and HCG level is initially less than 1,500. Medical treatment is technically by administering one shot of methotrexate. What this methotrexate do is that it stops the growth of the cells of the embryo, or technically the fetus. So it will not propagate or proliferate into a much worse case where it will grow and later on ruptured the fallopian tube. And on the other hand, just a segue note, around 95% of the cases of ectopic pregnancy happens in the fallopian tube, which is called the tubal pregnancy. And lastly, the surgical method. There are 4 known ways according to Dr. Shanchikala. First is the laparoscopy, laparotomy, salpingectomy, and salpingotomy. Laparoscopy is just by making a small incision on the area of concern, while laparotomy is when you have to perform a much bigger incision compared to laparoscopy, and is just usually used when there's already damage or severe bleeding on the fallopian tube. Next is salpingectomy. This is used by, this procedure is by removing the whole tube in the pregnancy, technically removing the whole fallopian tube. Again, this salpingectomy is also used for severe cases when there is already severe bleeding and extensive damage to the fallopian tube. And lastly is the salpingotomy. Salpingotomy is when they preserve the tube and they only terminate the pregnancy. So technically, they'll be just removing the embryo or the fetus, but the tube is still it's still intact. So with this area of scope, after this procedure, you are not allowed to have to create another pregnancy or to initiate pregnancy for at least 3 to 6 months, because most likely abdominal defects or fetal malformation could form due to the medicines that are being given, specifically the methotrexate. So with this reading, we are now given a whole idea on why is it important to early diagnose a suspected ectopic pregnancy, mainly because if we have reached to the stage wherein the fallopian tube is ruptured, massive bleeding will occur and severe damage to the fallopian tube will happen, and this could lead to also hemorrhagic shock, which will later on leads to death. And aside from this, if we could diagnose it at an earlier time, we could save much more money, save life, and save for much hassle, because early diagnosing can help prevent actually all of those further complications of ectopic pregnancy. So that will be all. Thank you.